My name is John Christoforidis, and I'm in medical and surgical retina. The new OSU Eye and Ear Institute on Olentangy River Road is a unique facility that provides all the subspecialties on one floor. It also has surgical facilities within the same building and several other specialties with whom we can collaborate with. It's also, from a patient perspective, a little bit easier to navigate, easier to park, to get in and out of, and I think a very pleasant environment to work in. There's no clear-cut reason why I went into medicine. It was just a field that I gravitated towards, and I sort of knew that, I think, from the time I was in the early part of high school, that's sort of what I wanted to do. There was no like defining moment. So, after you start medical school, you start getting exposed to all these specialties. It's a little bit overwhelming, and what I really liked about ophthalmology was that you get to treat both medically and surgically one organ, which is incredibly precious for the quality of lives that we have. So after my undergraduate and medical school at Ohio State, I did my internship at Mount Carmel in Columbus, and then I went to the East Coast. I did some research for about 2.5 years at the NIH, at the National Eye Institute in Bethesda, Maryland. And also I did my residency at Baltimore, Maryland General Hospital afterwards. I then went to Boston, where I did my clinical retinal fellowship at Massachusetts Eye and Ear Infirmary, and stayed there for a year afterwards as faculty before coming back to Columbus. During the course of my training, I was exposed to quite a bit of research, and that made me gravitate towards the academic world of retina, and also the mentors that I had, both at the National Institutes of Health and also at Massachusetts Eye and Ear Infirmary. And I think that these mentors for me were inspirational to go into an academic medicine. And in addition, I really enjoy being at the forefront of development within my field. What gives me the greatest sense of accomplishment in my field is in the clinic. When I'm able to take care of a patient either by medical treatment, surgical treatment, or sometimes just by observation. And even more so, if I can incorporate some of the findings that we have from the lab into the clinical practice, that's special.